Hi, my name is Joanna, and I'm from the School of Public Health, and I did my project on looking at the locations of free and low-cost health clinics in LA County and whether they correspond to need in terms of rates of poverty in the county. So some background, why is healthcare access an important issue? So one of the specific goals within Healthy People 2020, which is a set of national goals to improve health in the US, is to improve access to health services because this can positively impact a variety of health indicators, can improve prevention and detection of disease, increase life expectancy, and improve overall quality of life. And having access to affordable primary care in particular can prevent unnecessary hospitalizations in low-income populations. So in order to achieve access to health services, a person must first enter the health system, identify a service location, and then find a provider they trust. And typical obstacles to accessing care can include lack of availability of services or providers, high cost, and lack of insurance coverage. And community health centers are also a recognized model for improving healthcare access, especially in low-income populations and racial or ethnic minority groups, because these groups have historically faced more health disparities in their access and outcomes. And in terms of health disparities, traditionally in the US, we tend to think most about racial and ethnic minority groups, and this is definitely important, but we also need to pay attention to socioeconomic status, and in particular, it's best to look at these two issues together, so like looking at gradients of socioeconomic status within racial ethnic groups in order to strengthen the analysis. So the methods for my project, some of my data sources included data from the US Census on poverty rates and other demographic data. I also got some geographic data from there as well. I also have data from the LA County GIS data portal, including service planning areas, Department of Health Services community partners and facilities, and those are the primary source for the clinics. And I also added onto that list from the Community Clinic Association of LA County. So I created choropleths of poverty rates based on the census data and then mapped the clinics on top. And then I used buffer and overlay analysis to do some more in-depth analysis towards answering my research question of whether clinics are located in places of need. And I created 1, 3, and 5 mile buffer zones around the clinics, and then calculated what percentage of the total population and the population in poverty lives within these buffer zones. So I have just a few of my maps here for my results. This first one shows the locations of free and low-cost clinics throughout the county, mapped on top of the poverty rates. And just taking a quick look, you can see that they do look like they're mostly located in places with higher rates of poverty, but there are still large parts of the county with few or no health clinics available. And then map 4 here shows 3 mile buffer zones around the clinics and the areas that are affected by or impacted by those buffer zones. And from doing calculations from this, I found out that over 67% of the total population of LA County lives in a census tract that intersects a buffer zone of 1 to 5 miles around a clinic, and over 80% of the population in poverty lives in these buffer zones. And then these are 2 maps showing the Hispanic population in poverty and the African American population in poverty in LA County. So among Hispanics, they are 47.9% of the population of the county, and 22% of them live in poverty. And 99% of the Hispanic population in poverty lives in a census tract intersecting a 3 mile buffer zone around a clinic. And among African Americans, they are 8.4% of the population of the county, and 22% of them live in poverty. And of those in poverty, also 99% live in proximity to a clinic. So that's good. So some conclusions. Most of the clinics are located in regions in need in LA County, which I was happy to see. And over 90% of the total population in poverty and of each racial or ethnic group that I looked at does live in a census tract intersecting a 3 mile buffer zone around a free or low-cost health clinic. There are, however, groups of people living in poverty but living in places where there aren't clinics. And these groups should not be an invisible community. There needs to be affordable and accessible resources for them to access high quality care. And because this can have positive impacts on their own health, as well as prevent unnecessary hospitalizations, which is a good public policy. So this buffer and overlay analysis that I did for this project, it's only a rough approximation of the impact of these clinics, but it's a useful first step, and hopefully when I improve my GIS skills further, I can use more advanced methods of analysis to truly understand the impact of these clinics in LA County and elsewhere. Thank you very much.